Good afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Dr. Buchanan is off me and will be available during the question portion of the briefing today. Our moment of gratitude today is dedicated to everyone working to communicate important information in multiple languages during this pandemic. We specifically want to highlight our own Liliana Bourbano, who has taken the lead at the health department to ensure critical information is being shared to multiple groups in our community. Today, she is being recognized at Centro Hispano's Latino Awards for her efforts, and we are incredibly proud of her for this honor and the work she's doing. Our real life example of putting the 5 core actions into play is hosting a watch party for this weekend's game. We know we talked about this recently, but we felt it was important to bring it up again, given that the Vols' first football game of the year is happening on Saturday. We know folks are excited to see them play this Saturday and are already likely planning on hosting or attending a watch party. We encourage you to enjoy this time with your family and friends, but we want you to do it in a safe manner. If you're having people over to your house, do your best to limit the amount of people you invite to ensure that folks can be properly spaced out. You can even move some of your furniture around to keep at least 6 feet of distance between households. If 6 feet of distance can't be maintained, encourage people to wear a mask. We know it's not ideal, but it is one of the best ways we have in preventing the spread of this virus. There are also some great Vol-themed masks out there, so get you one of those and you can wear it to support the team. We've heard of some people moving to eat outdoors to allow for more physical distancing, and that's a great idea if you can do that. And when it comes to food, think about pre-plating individual meals before folks arrive. That way you don't have a group of people congregating around the food tables and being too close to each other, especially if they're not wearing masks. As always, encourage folks to wash their hands regularly and disinfect commonly touched surfaces like the TV remote frequently. Those are just a few ways to keep you and those around you healthy while still enjoying time with your friends and family. As a reminder, we are continuing our COVID testing today at the Jacob Building until 3 p.m. We will not be testing tomorrow. Next week, we will test Monday through Friday from 9 a.m. to 3 p.m. at KCHD's main location at 140 Dameron Avenue. And now we'll move on to the local situation. We have 60 new confirmed cases since yesterday's report, giving us 9,400 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 413 probable cases. 8,024 of our cases are considered inactive, giving us 1,712 active cases. 351 individuals have been hospitalized at some point in their illness, and 37 Knox County residents are currently hospitalized. Fortunately, we've had no additional deaths to report today, leaving our total at 77. And now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we are trying to see, are things getting better, staying the same, or are they getting worse? And if so, how much better or worse and at what rate? As a reminder, all of this data that we are going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and growth rate over time. During this time period, we saw 2 red flags, but not on consistent days. Overall, the data indicates statistical decreases and is trending in the right direction. On average, as of yesterday, we were seeing about 116 new cases a day. Because of all these factors, we are representing this benchmark as yellow. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of tests conducted for Knox County residents and another for average time between specimen collection and lab report data. Over the 14-day evaluation period, we did have 3 days of yellow flags noted regarding lab turnaround time, but not on consecutive days. The average turnaround time remains around 2 days. Regarding testing, overall, the number of tests conducted continues to trend up, as you can see on the trend line, but there is a slight downward trend over the last few weeks. There have been some red days noted, but those are typically on weekends when testing is not as widely available. Over the past 14 days, there have been an average of 562 tests per day. Even so, we still have concerns that folks are not getting tested when they should be. To effectively evaluate this benchmark, we are planning on really honing in on this data set for the next 3 to 4 weeks to determine where the trend is and if it's consistently going up or if it is in fact decreasing. For the time being, because of those factors, we are representing this benchmark as yellow. Of note, as of yesterday, the Tennessee Department of Health, according to the Tennessee Department of Health, the percent positive rate over the last 7 days is averaging at 8.2%. We are looking at getting that data on our website in the coming days. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to initiate investigations for new cases within 24 hours and close contacts within 48 hours. We've added 12 new team members to our EPI support team from last week. With this team, we continue to initiate investigations in our desired time frame. And because of this, our benchmark continues to be represented as green. We will continue to evaluate this benchmark and make any appropriate changes as the situation evolves. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System. It may reflect Knox County, the East Region, or patients from other jurisdictions. During this time frame, no consecutive flags were detected, but after speaking with our hospital partners, they stated their benchmark should be represented as yellow. The hospital systems continue to meet regularly, assess the situation, and plan their responses together. And as always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. And our fifth benchmark, sustained or decreased COVID-19 related positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. Over the past 2 weeks, 9 people have died related to COVID-19. The information available leads us to represent this benchmark as yellow. And I'll now open it up for questions.
All right, please go ahead and submit your questions into the chat feature. It appears that folks are typing, so we'll give it a second. The first question we have is from Vincent with the Sentinel. Last night, the Board of Health spoke pretty intensely about the need for testing. I know we've been over this a lot, but can you explain why testing is important for pandemic control?
Testing is just really one of the most invaluable tools that we have for pandemic control or mitigation, in that it allows us to effectively be able to identify cases, even if they're asymptomatic, because we know that there is asymptomatic and pre-symptomatic spread, which means people can be out there and living their normal lives and around people that have this virus and not know it, but be spreading it. So having a sufficient amount of testing allows us to then identify positives that may or may not know that they were symptomatic, may or may not know they were positive, and then contact trace based on that, which means that we are able to rapidly get them out of the community and not exposing other people, and then work towards getting their contacts out of circulation in the community as well and into quarantine, so they aren't going to potentially expose people if they are incubating and going to develop the disease later on in that 14-day window. And so it's very, very important for us to have an idea. Other than that, just, the situational awareness of what's happening in the community, being able to make good decisions based on the data that we have in hand is very important. And when we know testing is low, we know that's makes the decision making more difficult if we don't have sufficient testing in the community. Those are just a couple of reasons, but it is very important. And we do want to encourage folks to get tested. If you're been exposed to somebody that has COVID-19, if you're symptomatic, or if you're concerned, testing is available throughout the community. And we don't want you to be scared to get tested. We want you to do it, and we'll follow up with you and help you through the process if you were to test positive.
From Grace with WBIR, can you all share your thoughts on the Freedom Forward TN video that was played during the Board of Health meeting last night?
Do you want my thoughts or Dr. Buchanan's?
Grace did not specify, so Grace, if you're looking for someone in particular, she says, oh, Grace just said both. Okay.
From my perspective, it was disheartening to watch, just being honest about it. For my team, truly, there was a lot of folks that were very concerned after they saw it. It circulated around the staff here, and they came to me and voiced concerns about it for their safety. They're worried about their jobs, and just they're trying to do their jobs and trying to do what they can to help protect the community. So it was a hard thing for me to view. That's my opinion on it. I'll let Dr. B speak.
I'll echo Charity's. It was disheartening to watch for myself, and I know for team members here at the health department. The association between the Board of Health and the health department. The Board of Health is our board, and so those images and the words that were used really were challenging for us to hear. Of course, everyone's entitled to express their opinions and have their own opinions, and we respect that.
From Jeff with WATE, Dr. B mentioned Tuesday that we can't really do wastewater testing like UT does, but is there some other systematic test setup that Knox County can try?
We do not have any other systematic testing available. One of the challenges, if you're going to use it and using pooled testing, one of the recommendations is that you actually have a lower % positive rate, or it isn't helpful. Because if you have a high % positive rate, right now our % positive rate is in the 8 range.
Yeah,
last week.
Or this week.
This week, yeah. And so, if you do pooled testing, the likelihood of most of those people being positive doesn't really help, because doing that as a community-wide surveillance tool is to be able to say these people don't have it. The people where you have the pool testing or saliva, somebody in this group has it, or maybe more than one person. So then we can test the rest of them more closely. If you're just having to test everybody, it really doesn't help.
From Vincent with the Sentinel, what do we risk when people avoid testing, and has the health department considered ways to incentivize testing?
Well, we risk people having COVID and walking around and being unaware that they have it and making other people sick. And we, the health department, lose an opportunity to educate, inform, and protect the public because we don't know about that case. And nobody wants to make other people sick. So we really encourage folks, if you're concerned, to get tested. We haven't thought about incentivizing people to test. I think wanting to know about your own health should be an incentive. Wanting to know so you can protect others, I would think would be an incentive. But we have not thought about that. We have talked about, do we need to change your hours? But in the past, when we've changed hours, it hasn't improved uptake. So I'm not sure we'll do that either.
Can I?
Sure.
Sorry. To add to that, I just want to kind of go to the secondary effects that can happen from people that that don't get tested and they don't know, and disease continues to spread. And where we're coming at with our concerns and the recommendations we make is knowing that if the more cases that are out there and the more people that get infected, then a portion of those people are going to end up in the hospital and they're going to have negative consequences. And that has impact for everybody, whether you have COVID or not. If the healthcare system can't manage that, that impacts whether or not you're able to be seen rapidly if you're having a heart attack or a car accident. So there's dominoes that fall based on not knowing and disease spreading in the community more than it is already at this point. And that's what we're really trying to prevent.
From Austin with WATE, taking a look at the death toll, there were 34 deaths in July, 19 in August, and we are at 19 for September already. Are we worried about this trend, and do you expect October to be worse?
We don't like trends like this. It's very concerning. I think that we talked about it, or Dr. Shamia talked about it last night. We are seeing a younger demographic that are getting this at higher rates than others. So that tends to not lead to, it might lead to hospitalizations, but the hospitalizations may not be as long, and they may not have died from this. But again, there's potential spread and exposure from those folks, and we may see cases trending up over the coming weeks from this younger demographic in their contacts in older demographics. And so it is concerning and something that we're keeping an eye on.
From Ariel with WVLT, are UT students quarantined in local hotels being monitored by the health department, by the university? And while in quarantine, are they required to stay in their rooms?
So they are being monitored by Department of Health, like all of our other cases are. And then, yes, they should stay in their rooms unless they need to go to the hospital or a healthcare provider appointment or something like that. So the students at UT are being given the same guidance that anybody in the community is given that are contacts to cases and are in quarantine, or the same thing for their cases that are in isolation.
From Bob with the Knoxville Liberty Press, the federal government recently updated their survival rates by age group. Over 70 years old have a 94.5% survival rate, while those under 70 have a 99% survival rate. When will the Board of Health regulations be lifted?
So there's a lot of discussion about that. I can't speak for the Board of Health, but they are looking at different metrics to review and determine when they will lift them. I'll point out that even 1% of the population in Knoxville is over 4,000 people. And so I don't, from my public health perspective, still don't think that a fatality rate at that size is something that we want to shoot for. So I just want to make that point, and then the Board of Health can expand on when they will be lifting their recommendations and their guidelines.
Also from Bob with the Knoxville Liberty Press, why have deaths and cases gone up since the mask mandate went into effect?
Well, this disease doesn't stop. And so I think that's a good point. I've seen a lot of questions about this. The rate of did go down, the rate of growth after the mask mandate, but the mask doesn't make the disease go away altogether. So with infectious diseases, the amount of infection that we have and our case rates are going to continue to go up. There's nowhere else for them to go. But what we want to look at is the rate. And we did definitely see, before we had the changes with people interacting more with schools and the university, we saw the rates of the disease of new cases going down after the mask mandate. And that's something that's was seen all over the country with that. So, but there's no way for it to just cut off. There's still people that have the disease that come in contact with folks. But the point is to keep that rate of new cases as low as possible.
Another question from Bob with the Knoxville Liberty Press. What data can you display or release to the public that proves deaths or cases are coming from bars and restaurants only after 11 p.m.?
I think that the decision that was made, and again, this is probably a better question for Board of Health, was based on behavior and risk areas where folks are congregating from the White House Task Force report that came out, from the guidance that those experts in the country that are advising folks all over are telling us that other jurisdictions are seeing, is that's a high risk activity. When you're in close contact with folks, you're not wearing a mask typically if you're eating and drinking, and drinking lowers inhibitions and all of those things. That's a higher risk activity, and that's what we were trying, or the Board of Health was trying to prevent.
From Vincent with the Sentinel, I know that incentives are hard to develop, but quarantine and isolation are also hard for people. There was discussion last night about putting some kind of stepped opening / closing structure in place last night at the Board of Health, similar to West Virginia. Could you speak to that, please?
Dr. B wants to speak to that. Let me step.
So the discussion last night was not about stepped opening or closing. It was about setting some metrics for when we can either lift a mandate or have other activities. You can certainly go look at West Virginia's pattern. I don't know that our method, I don't know that the Board of Health will adopt a similar method to West Virginia, but using data based on case rates and hospitalizations and testing, which is really important, making decisions based on that data, and also giving information to the community about where we stand and where we are and what we can do, what we cannot do.
Question from Grace with WBIR for Dr. Buchanan. She asks, can you explain why Board of Health members feel threatened?
You'd have to ask Board of Health members that question.
From Bob with the Knoxville Liberty Press, what data or science proves this behavior has increased cases or deaths in Knox County?
So what we learned from Dr. Burks with the White House Task Force, she has the advantage of being able to see the entire country. She's a countrywide view of what's happening with COVID, which we don't have. And so what they have seen is in communities where they have an increase in cases like we did earlier in September, what they have seen if they close the bars or they close bars and restaurants, or they close them at 10 or they close them at 11, case rates go down. Like Charity said, we've all been there. You go out to dinner with your friends, the longer you sit there, you have a few more drinks, and before you know it, everybody in the bar is your buddy, and you're chit-chatting and doing all that social stuff. That's great fun, but it's just the opportunity COVID needs to come in and cause an outbreak. We want to prevent that from happening. And so it's based on data from across the country where they had success with making these decisions. I think the board was really reasonable in considering the option of 10 p.m. versus 11 p.m. Closing bars and restaurants at 11 p.m. gives them an hour more of business. So hopefully that's helpful for the businesses.
From Brian Hornback, is there any new information on new reinfections of people that have had COVID?
I'm going to let Charity take that. She's been talking to the state more about that.
We have seen some folks that test positive again a second time. The guidance that we've received from Tennessee Department of Health, and they're speaking with CDC and lots of folks on this, because again, let's remember that we've only been dealing with this infection for a few months, and so there's not a long body of knowledge and evidence about reinfections and how long immunity lasts and all of those things. Right now, if you test positive again within 90 days of your last test, we are not treating you like a new reinfection. We're not asking folks to isolate and quarantine their contacts during that time period, if it's within that time period, because right now the evidence that we can see in the short amount of time we have is that it looks like there's at least 90 days of protection there for immunity. So that's that. If we have a case and we've had maybe one or two that fall outside of that window, then that's a really deep dive in a discussion with the health officer and the folks at the Department of Health to really look at the situation. Have they had a new exposure? Are they living with somebody who's now COVID positive that wasn't before and they're symptomatic? Is the case symptomatic again after they had not been before? All of those things come into consideration on how to count those cases and treat those cases moving forward. And so far, in general, the recommendations from the Department of Health have been, for the ones that we've had, because it's been really close to that 90-day window, is to treat them just like how I just described before. But those are reviewed on a case-by-case basis until there's a larger body of evidence on the time frame that we go with.
From Bob with the Knoxville Liberty Press, what science or data proves these cases in Knox County, and how many clusters have been identified from bars or restaurants?
We have a lot of our cases. We're talking about and naming bars and restaurants that they were going to. We didn't have clusters associated with them. We talked about that a lot, and that linking up people within those environments is challenging because you don't always know who they are and how to reach them and those types of things. But we were absolutely seeing and hearing from our cases that they were going to those places. The other side of this coin that I think that we've been missing the point on talking about is if we wait for us to have the data to support it, we're behind the curve and there's more spread and there's more of those negative consequences that I just talked about that can happen across the community and affect a lot of people and have impact on their health and their well-being. And that impacts everything from health to the economy to everything. And so trying to take a proactive approach based on science and data that we're being given from experts across the country is something that I would think our public would want us to do to help prevent the spread of this disease.
Another question from Bob with the Knoxville Liberty Press. Why closures at 11 p.m. versus 10, 9, 8? How is this time and closure supported by factual data? Where can we read this data from the Knox County Health Department?
I think that I've hit that a lot of times so far. I think that the board was trying to understand the ramifications to the economy and consider that and do everything they can while also trying to mitigate risk. I don't know how much more I can talk about that. At this point, I would suggest that you direct further questions to the board on that.
All right, any other questions? Please go ahead and submit them now. All right, not seeing any other questions come in, so thank you all for your time, and we'll see you again.